St. Joe's genitourinary researchers are conducting basic translational and evaluative research to improve patient care, find more effective treatments for kidney, bladder, and prostate cancer, and create innovative techniques to train the next generation of urologists. Over the past year, the genitourinary pillar has earned several grants. Researchers were awarded a $20,000 McMaster Surgical Associates grant to study the use of three-dimensional kidney models for simulation-based robotic surgical training in urology residents. The Drewinski Cancer Center Foundation awarded a $50,000 grant for a prospective randomized pilot trial, which will study stereotactic body radiation therapy versus radiofrequency ablation in managing small renal masses. And finally, genitourinary researchers are studying PCSK9 as a novel contributor to the development of a specific form of prostate cancer that is resistant to androgen deprivation therapy. Led by Dr. Demu Tang, this work is supported by a CIHR grant of nearly $600,000 over 3 years. Dr. Tang has applied for 2 patents based on his basic science work this past year, and Dr. Bobby Shagan has successfully implemented a same-day discharge program after robotic radical prostatectomy. This program has spurred various knowledge translation efforts, including abstract presentations and publications. Notable publications include the findings of the CLEAR study, a randomized phase 3 trial in patients with advanced renal cell carcinoma that compared 2 treatment regimens, which was published in The Lancet Oncology in June. Researchers also published a guideline document for the Canadian Urological Association on the management of small renal masses. And our robotic surgery researchers, led by Dr. Edward Matsumoto, published a review and meta-analysis on extraperitoneal versus transperitoneal approach for robot-assisted radical prostatectomy. Future goals of the genitourinary pillar include increasing the amount of peer-reviewed funding for junior faculty, increasing the number of publications in high-impact journals, and further innovation and novel robotic research with St. Joe's robotic urologists. Ultimately, the work of St. Joe's genitourinary researchers will lead to better care and better outcomes for patients in our community and around the world.